There is something about leaking. Leaking results from premature or early rupture of membrane. One of the common cause of premature rupture of membrane is hydramnios rather than polyhydramnios. What symptoms and signs should be looked for in a patient complaining leaking to find out the polyhydramnios or hydramnios as a cause of the leaking? At first sight, leaking might not have our attention, but it's serious one due to serious etiologies of hydramnios. Most common causes are hydrops fetalis, anencephaly, and uncommon but most serious are esophageal atresia, open spina bifida, facial cleft, as fetal causes, which should not be ignored, so that they are tried to be corrected as far as possible after birth of baby or even during pregnancy, and precautions during or before pregnancy which must be taken. Maternal causes, diabetes, cardiac and renal disease of mother impart fairly major portions of hydramnios and its complication premature rupture of membrane and consequently leaking, which itself causes infection, which again can be dangerous for fetus and also for mother. Antiseptic precautions can check this if we will be conscious and cautious about these etiologies as causes of hydramnios and pre-rupture membrane or premature rupture of membrane, which result into leaking, which leads to infection. Lack of liquor and bulging membrane at presentation on PV exclude presence of hydramnios earlier and should not avoid in paying attention towards its etiologies. Patient may present with absence of symptoms and signs of hydramnios and absence of leaking because of presentation after a fairly long time from the start of leaking due to premature rupture of membrane. Leaking and also absence of membrane without leaking both should be thoroughly inquired with patient to reach up to the diagnosis of hydramnios. Before doing investigations to confirm our presumptive diagnosis, to avoid missing of diagnosis of this serious one, investigations which can we ensue only if we suspects about that. Thanks. There is something about leaking. Leaking results from premature or early rupture of membrane. One of the common cause of